Hi, welcome to Body Beautiful. I'm Janelle Marie. Today we're talking with board-certified plastic surgeon Dr. Joseph Mealy in the San Francisco Bay Area. Doctor, thank you so much for joining me today.
It's nice to be here.
Well, we're going to talk about arm lifts, and this is huge
Okay.
because a lot of women, we talk bat wings. We do not like the arms sagging and waving when we wave. Is
I've
this
never
true?
had anyone ask me to make their arms looser.
That is so true. So, doctor, who comes in for an arm lift? Who's a good
So,
candidate?
Arm lifts are for people who've really lost a lot of weight. It's not
Right.
good for someone who has a little bit of laxity because it leaves a scar. So it's
Yeah,
for
right.
someone who trading extra skin that sometimes doesn't even fit in a sleeve for
Oh,
a scar.
yeah.
That sounds like a good idea. Then you're a good candidate for it.
Yeah, a lot of women come in because they cannot fit into,
Yes,
nice
and especially
sweater.
women who've lost 100
Right.
pounds, 150 pounds. They want to feel like they've lost that weight. And when they have that
Exactly.
reminder, that tightness in their sleeve, it's not a great feeling.
Well, let's go to picture number one because this is
Sure.
an amazing before and after. What is going on?
So this is a woman who had about twice as much skin as she needed for
Yes.
her arm. So
Wow.
what I've done is just remove all that extra skin. We have to do a little bit up into the armpit too because we're raising that skin
Yep.
up to where the muscle is and tightening it. So in her case, before if she was waving, the arm would keep waving.
Oh, yeah.
Afterwards, when she stops, it stops.
It's beautiful.
It's tight.
And the scar on this surgery would be where?
So the scar runs from the inside of the elbow to the back of the armpit.
That's amazing that you can't see it from the front. Can you see it from the back, if, let's say?
The idea is to put it right at the bottom so we don't really see it. So
Right.
when the arm's against the side, it's hidden. The other incision that a lot of people use is in the fold along the bicep. And I think that's just too visible. I don't
Yeah.
like seeing that scar.
No, definitely
So
not.
obviously, if you're raising your hand up high, then you're going to see the scar.
Yeah, but it's worth it to get rid of bat wings. That is definitely worth it for sure.
That makes people very happy.
Very happy. Let's
Because
go
it's
to
something diet, exercise, it doesn't make it go away.
Yes. Why is that with women? Just because we don't have a lot of muscle tone?
No,
that's
it's the skin.
Ugh.
Our body is adapted, so if we get bigger, the skin adapts and gets larger, but the organ doesn't shrink when we lose weight.
But
It
that
does
do-
to a small extent, but not enough.
It doesn't seem to happen with men, though, doctor.
It does.
Oh,
Yeah, it does. I've done arm lifts for men
Okay.
too.
Well,
It
that's
just depends
good.
on where you put the fat.
okay. Well, so men do come in for the surgery then?
They do.
I-
If they've lost enough weight,
Okay.
it's done. But I think men tend to put more fat on their trunk,
Yes.
so they less often have the enlargement of the arms with the weight gain.
All right, let's go to picture number two because this is unbelievable what's happening in this before
So
picture.
this is a young woman who's had this her whole adult life.
Wow.
So most likely it's not just fat, but it's a little bit of breast tissue because you can get breast tissue
Oh.
anywhere from the armpit to the groin.
That's
And sometimes I'll see it even has a little nipple on there.
oh, geez.
I've had patients that didn't have it until they got pregnant, and then it enlarged with pregnancy and wouldn't go away.
Wow.
So that tissue needs to go because it's, again, very difficult to dress. And it looks unsightly hanging
that's-
out if you're wearing a tube top or tank top.
And that looks like the only problem she has. So it's almost
Yeah.
not like a weight loss problem. That's just a third breast problem.
Yes. So in this
Ooh.
case, it's how she was born, and she's not having it anymore. So
And
what
that-
we did is we removed it with a similar scar. In this case, it's it gets to be halfway down the arm. Usually, I have to make that longer scar. If it's a smaller amount just in the armpit,
Yeah.
we can do a mini arm lift and just put the scar in the axilla so
Wow.
it runs across the armpit. But in this case, it was large enough. We needed to tailor the skin and also, again, reconstruct that armpit. So get the skin up into the armpit.
That after picture is amazing. I mean, you can't see any scar or anything, and looks
So much
beautiful.
more comfortable. She's happier with her clothes on, and then with the clothes off, it's all better.
And before we go to picture number three, people come from all over the Bay Area to see you, right, doctor? I mean,
Sure.
From
Well,
all
the
over.
wonderful thing about the internet is it goes everywhere.
Exactly.
So I have people coming from other countries even to come have surgery.
Sounds good.
Plus, the Bay Area is a nice place to visit.
Absolutely. And you can see all these before and after pictures on the websites. I'll give those out at the end of the segment. Let's go to the next picture. It's almost similar to
So
the
this
one.
is a patient who, this is more weight loss, weight gain. So it extends farther down the arm.
Okay.
And the skin's much looser. In the previous patient,
Yes,
the skin was
definite-
pretty tight because it
definitely.
was full. In this case, it was fuller before, and now it's emptied.
Wow.
So same idea, make that incision right along that inside of the arm, get rid of the extra skin, any of the extra tissue, the fat or whatever's left there gets removed with the skin. Very unusual to have fat on the upper part of the arm, but if there is, sometimes we'll do a little liposuction to complete it.
It was only on her one arm, correct?
No, it's on both arms.
Oh, it's on both.
Oh yeah. No, this is someone who gained weight and lost it, so it's on both
Oh,
sides.
okay. Before we go to the next picture, what's the downtime for an arm lift?
So for arm lifts, it sometimes causes some swelling of the hands. So if somebody has carpal tunnel syndrome, let's say, before, I might make it a little worse for a couple weeks, and then it tends to get back to normal. I do have you wear a garment, so the garment goes from the wrist all the way across. It's like a bra with sleeves. So it gives nice even compression, keeps things smooth,
Yeah.
gives good support, and I think it helps with the recovery also.
And the final picture?
So final picture, again, just extra skin.
Lots of
And
extra skin
It
on
hangs
that.
all the way to the elbow in this case.
Wow.
But the surgery takes care of it. You just get rid of that extra skin, you stitch it up, and in a couple weeks, usually people are back to doing what they want to do.
And you know, with women, a lot of times we want to wear the sleeveless shirts. We have the sleeveless dresses if we're going
Sure.
to a nice party. We want to be able to wear those no matter our age. And this can help at any age, am I right?
It can. Again, you got to accept the scar.
Yeah. Oh, well, absolutely. Absolutely. But you can help older patients maybe that, you know, just have saggy skin because of age as well as younger, correct?
It's true. Yeah, if the skin is loose, we can tighten it.
Okay,
And
good.
I think the longevity of the result depends on the elasticity of the skin. So if you have good
Exactly.
elasticity, it's going to last much longer than if they have kind of poor elasticity.
And maybe getting into the gym and arm lifting some weights and stuff might make it
Always
look
a good
even
idea
better.
to get in the gym, keep fit.
Keep it filled out.
But it doesn't tighten skin,
No,
unfortunately.
I know. All right. Thank you so much, Doctor. Remember, you can see all these before and after pictures on the website, sanfranciscobreast.com, drmealy.com, or call the office for more information, 925-943-6353. Dr. Mealy, thank you so much for joining me.
Thanks for having me.
Yeah, we'll see you next time on Body Beautiful.
Okay.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.